Uh, the numbers remain grim where COVID-19 is concerned. We are closing in on 5 million reported cases worldwide, 1.5 million plus in the United States. According to the CDC, 92,333 American lives have been taken. Here's the good news. Almost 300,000 Americans have recovered, and that's up more than 6,500 from yesterday. And joining me now to talk about the recovery process and other matters COVID-19 is Chief Medical Editor for BNC, Dr. Corey Hebert. Welcome again, Doc. Dr. Hebert, are you able to hear me? Okay, well, let me go ahead and ask you a question. We'll figure out why I can't hear you. We're hearing that this virus can have long-lasting, even permanent effects on those who've suffered from it. Could you tell us more about it? Okay, we're having trouble communicating with Dr. Hebert. I promise we'll bring him back as soon as we get things straightened out. We'll take a break here, though. Still ahead, new details in the shooting death of Ahmaud Arbery, the latest move by the Georgia Bureau of Investigation.
Hello? Okay, I'm on the phone, but we did a mic check. She could hear me fine. We did that before it started. Okay. Yeah, no, I could tell. I could tell, but I mean, we actually talked. She was like, "I'm glad to see that you weren't in your truck." We talked before we went on. Yep. Is that better? Okay. Okay.
All right, we found all the gremlins. They've been ejected from the building. So now we have Corey Hebert back with us, BNC's chief medical editor. And Dr. Hebert, was asking you earlier about the recovery rate, and we're hearing that this virus can have long-lasting, even permanent effects on those who've suffered from it, although they survive. Could you tell us a little bit more about that?
Yes, I think my microphone had coronavirus. I'm not sure what happened. Yeah, so we know that in all viral infections, you can have a repeated infection over and over and over. That's the first thing. The second thing is that the sequelae, meaning the things that happen after the infection are over, can last for many months. So even though most people won't have symptoms, some people will have mild symptoms. Some people actually will have, about 5% will have a really, really bad course and get intubated and have a really horrible pneumonia on life support. Once they finish, they have about a 6-month course to get back to normal. Most of the time, 6 weeks, you are about 95% back, but it takes a while because this virus can do damage. But when we talked about around the world, we looked at the World Health Organization numbers. These numbers are disturbing because we know things, I mean, what you have to remember is that the #1 cause of death in America in the last couple of months was from COVID-19. The #1 cause of death, Fred. So what does that mean? That means that more than heart disease, more than murder, more than cancer. So if we have all these beautiful hospitals with all this great information, all these great doctors, imagine what's going to happen in Bangladesh. Imagine what's going to happen in the Congo. What's going to happen in those places when this hits? And that's the numbers that they're talking about. And that's also the amount of people that are going to really get sick and have a long term of healing from this horrible virus.
And even as all this is going on, Doctor, and you mentioned it, President Trump is threatening to pull the plug on WHO funding when it may not be as necessary here, which it is, but in these other countries that are poor, it's disastrous.
Yeah, not a good idea. I mean, if you want to punish the World Health Organization for not responding appropriately or keeping information from you, there's lots of punitive things you can do. But you probably shouldn't do it in the middle of a pandemic that we haven't seen the likes of since 1918. That's not the humanitarian thing to do. I don't think that he'll get away with doing that. I think if he did do it, other countries would come to the World Health Organization's back and to be able to give them money to subsidize. But I don't think that that's a good look for the president or for the United States, because it's not a good thing, especially when we know the damage that can be done with not having the resources, testing, medicines, and the like in one of those in a country that's a third world.
See, CNN is reporting, they're not the only ones, that the CDC's officials, some of them, and the administration simply are not on the same sheet of music, to the point of those officials feeling their word muzzled. Can you fill us in on that at all?
Yes, well, we know that that's the case. We know that that there was a whistleblower incident where the guy that was over the vaccine portion of the CDC was kind of muzzled, and he said he got pushed out because he didn't want to say that hydroxychloroquine would work. There's all types of fodder. We don't know, Fred, really what the deal is with that, but what we do know is that they are not on the same page. By any means are they on the same page. And, generally what we've seen is that when you don't agree with the president for whatever reason, then the president gives you a hard time and then tries to get rid of you. So if the problem is that the only people that really suffer from that discord is the American person, the American citizen. That's the person that suffers from that discord, because we're the ones that won't get the data. I mean, we're the ones that it took a week before the CDC gave us the more appropriate guidelines after they made the guidelines, and then the White House kind of shelved them and came up with their own guidelines. Who suffered from that? Georgia opened without having those guidelines, and now that we have them, I mean, how many people could have gotten exposed in that week amount of time that didn't have those really specific guidelines from the CDC? So the American public are the people that get hurt when these things happen.
Well, Georgia, Florida, Iowa, South Dakota, all of these places. How do you, as a scientist, as a doctor, as a clinician, how do you help to depoliticize this whole thing?
There's no way that the medical public can depoliticize it, because we know what the science is. I mean, you look at a drug like remdesivir. We know that remdesivir has gotten a lot of publicity for working, but really some of the studies, we haven't even seen all the data on the studies. We haven't seen the data, so it's all politicized because people want a cure. We've seen that Moderna has come out with the vaccines and they have neutralizing antibodies, and that's good, but we haven't really seen the data on that, and we don't know if neutralizing antibodies from coronavirus actually help protect you in the next go-round as far as being protected from being infected again. So all these things are very politicized because people want a cure. People want to have hope. But until the data speaks to that, we have to remember that as scientists, if you don't have a placebo-controlled trial, if you don't have data to support people doing something and not doing something and comparing them, we really don't have the gold standard on being able to provide the appropriate care for people or preventive care for people. So it's hard to not politicize it, because the stories must be told, and news will lead the day as well. So people will tell the stories.
That's right. Dr. Hebert, the one and only doctor for the people, chief medical editor for us. Thank you so much, as always. And we'll talk to you tomorrow.
Be safe.
All right, you too.